You're listening to the Savoir Faire Audio Experience.
Are you ready?
The Savoir Faire Experience is your guide to everything that has to do with lifestyle. From dating, rides, style, and entertainment. All brought to you by the editor of Savoir Faire magazine, Robert White. Anything goes on this audio experience. So, let's go.
It's still the best.
All right, guys, thank you for listening to the Savoir Faire Audio Experience. We appreciate you. We see you following and sharing, and please continue to do so. We love the attention, obviously, and spreading the word about some of the great people that we interview here. Today, we're going to interview someone who's really like a very cool dude, and I'm really excited to talk to him about for a lot of reasons. But this is Dr. Lonnie Herman. How are you, Donnie?
I'm great. Thank you. I appreciate you having me on the call and me getting to share this.
Yeah, well, I'm excited. It looks like you're doing some really cool stuff over there, so I definitely wanted to unpack it with you and dive into some stuff. One of the things that we like to do at Savoir Faire, or that I like to do really, as the host, is just let people have the opportunity to introduce themselves. And so I'm really curious about some of your background and things that led you to the stuff we're going to talk about today, which really is just kind of skin health. But so maybe you can give me a little bit of your resume, your backstory, and how you kind of got focused into this specific aspect of medical service.
Well, many years ago, I had chosen chiropractic as the direction I was going to take in life for certain sports injuries that affected me and affected my older brother. And when I fast forwarding to when I came out of school, at least the school had taught me that there's a way to heal naturally was the kind of philosophy behind it. And I realized though when I came out of school that it was not enough for me. I had more desire to help people with chronic ailments. There were people around me who were developing different conditions like Parkinson's and cancers and so on. And I realized that the school I went to was not enough. It didn't provide me enough information because I'm the type of person, my patients call me Sherlock Holmes. I want to be able to figure it out and provide the solution for them. And when it comes to the skin conditions that I'm very effective at helping people completely resolve and make it disappear after some people decades of suffering with horrible disfiguring skin rashes like eczema and psoriasis and so on, dermatitis and so on. I found in myself because I had hives as a child and I was always searching for answers. One of my dogs even had a terrible rash and the vet wasn't helping after a while. So I had to find the answers. And I had gone back to school for neurology and for neurochemistry and for immunology and endocrinology and GI disorders and developmental disorders of the brain. And I realized that the understanding about genetics and something else called epigenetics. And I realized that the Western medicine understanding of things, because coming from the chiropractic background, people had always looked at like, your education's not enough. So when I went back to school and I was gaining ground on understanding about genetics and certain blood labs and autoimmune disease and so on, there was still something missing from that healthcare model. And I got into Chinese medicine and different types of Indian medicine and others. And then which led me to biophysics and quantum physics. And fast forward to now, the incredible positive changes that we see, total restoration of somebody's skin going from a totally disfiguring, in some cases where their skin is covered in an itchy and unsightly rash, to just perfect, beautiful skin, and the rash disappears like it never existed. It's great work, and I'm thrilled to do it, and grateful that I figured this out to help people. So hopefully that answers my background.
Yeah, I think it does. That's very cool, and I appreciate that. So, I mean, we're talking about like eczema, acne, all kinds of like skin conditions. Then you really have kind of dove into some of these things and analyzed them deeper than what most people have, because I think the over-the-counter creams are kind of like not something you recommend. There's definitely something deeper to your process, which I kind of appreciate. You kind of created a method or a system called the Quantum Skin Health Restoration System. Can you dive into that a little bit and tell me what that is?
Yes. So And generally, overall, for all different conditions, we call it the quantum resonant medicine approach. And then I started to see with people with lupus who were coming to me for care, and different other conditions where people, the number one thing for them wasn't their skin condition. In some cases, there were these pain disorders that they had, and asthma condition, and even just like the brain was like ADHD, but they also had eczema. And so it was sort of a bonus that when people had these skin conditions, that I was able to figure out their skin condition along with their other results from their health condition, their autoimmune inflammation, and so on. And so I started to realize, let me dig deeper into these different chronic skin conditions, and we came up with this quantum skin restoration protocol. And in immunology, the immunologist who had a PhD in immunology, who actually has patents on many of these different autoimmune antibodies that have been discovered in the human body. And when I took the immunology postgraduate studies in immunology, he had shared so many journals from laboratories around the world that were not funded by drug companies. You know, the drug company wants the drug to be the answer. So they're the end of their research project is that the drug or the steroid or the cream or the whatever, or the anti-inflammatory, whatever it is the answer to the condition. Mm-hmm. Well, these scientists were looking for answers as to why the disease occurred in the first place. And every single disease, whether it was lupus or MS or asthma or Hashimoto's thyroiditis to diabetes and many other diseases, that rheumatoid arthritis, that these are all driven by A, toxins, and B, infections like viruses and mold infections and fungal and bacteria and parasitic infections leading to the arthritis, leading to the MS disease, leading to all these different conditions. And when it comes to skin disease, and I know from myself and actually treating my loved one, my dog, that took 3 years to figure out what to do for him, which some epiphanies went off during that whole 3-year process, is that it's all about the germs that get in the body. People are carrying around measles, literally. People are carrying around staph infections, and they're carrying around candida fungal infections and ringworm infections that can A, lead to the skin rash, and B, lead to other pain disorders, whether it's heart disease or chronic migraine headache, or back pain or bone pain or fibromyalgia pain. And we started to see, as we started to then focus more on these skin conditions and neutralize with this work that I do, literally neutralize safely, effectively, naturally at a quantum level, be able to neutralize these different disease-causing infections. A, their rash went away, but also their brain fog went away, their asthma went away, their pain in their body went away, their ADHD symptoms went away. So it became a great experience. And excuse me, I went off on a tangent there, but I don't remember your first question there, but it all comes down to the germs in the body is what the immunology research has showed me. It's the different bacteria, fungal, mold, parasitic, and viral infections that literally lead to these different chronic pain disorders, but also these skin conditions. And that's why when a doctor can go to, I'll take it a bit deeper, is that when a patient with a chronic skin condition, whether it's psoriasis or they have just a discolored rash that's not called psoriasis or eczema, they can get these allergy tests, whether it's an environmental allergy test or a food allergy test, or they get a skin biopsy, and the doctor says, we don't know why, but stay away from these foods or stay away from these soaps or these perfumes or so on, because those different environmental stimuli will cause an aggravation or exacerbation of their rash, like stay away from tomatoes, or stay away from chocolate, or stay away from dairy, or stay away from ice cream or something. We found that it's not, and the biopsy will show no infection in the skin. It's because what I realized, and one of my great mentors was a biochemist, and he always talked about it's not the food that was the problem, it was the infection in the organ that was the problem. And once I realized to put two and two together with, let's say, the spleen that was carrying a measles virus, and it caused a rash on their skin, on their chest, or their liver had a scabies infection, they had itching on the body and bumps on the body. Once we got rid of the scabies infection from their liver, let's say, they had better digestion, but also the rash on their arms went away. So these infections literally go deep into the tissues in the brain, in the organs, in the bones, and the lymph, and the muscles, and that's where they're hiding, and they result in a rash on the skin. So again, with this topical steroid, that can cause serious problems, or with a cream, or with an anti-inflammatory, or with an immune suppressant medication or a steroid injection, they don't get resolved because it's the infections in the body. They can't cover it up for too long because it's the infections that are still raging and that are in the organs and in the bones and in the brain and in the lymph that are causing the rash on the skin. And once I found this research that was developed by biophysicists in Europe back in the 1990s, and I started to put all the schooling that I went through for a good 10 years postgraduate study and started to really think about it and put these different, all this different research together and resolving these or neutralizing in each patient the different germs from the different organs in the body, their symptoms went away, but also their skin rash went away. If that answers that question.
No, that definitely answers that question. And it's very unique too, because I've been through some health conditions before where even personally where people didn't understand it. For example, when COVID was around, I got COVID and I was extremely sick for like weeks, losing weight, losing all kinds of things were happening to my body. And it was really kind of overwhelming. I had gone to the ER or to a doctor's office multiple times to get help. Like I just felt like I had no control. I need someone to get in here and fix this stuff. And on my like 7th or 8th visit to the ER, begging for help, like literally falling apart, a doctor finally came in and they ran some blood work, which had not happened yet. And they did some other things. And he's like, you know what? I think you have COVID, but it's so mild that it's like not something we should be concerned about because your thyroid is going whack right now. And they completely found from the blood test that my thyroid levels were crazy. They fixed and treated the thyroid thing, and I got totally healthy again. And it was like had nothing to do with the original issue at all. So when you're talking about this, it's reminding me of that situation, realizing that, all of these germs and conditions are kind of in other parts of our bodies, and the body's reacting and putting these kind of exterior kind of skin conditions on us, basically to kind of set an alarm off, right? Like it's the alarm to say, hey, there's something wrong here. And if we could analyze what those skin conditions are, like the way that you are, it makes sense that, okay, the skin is red and whatever. I don't know the medical aspects of stuff, but if the skin is red in a certain part, then that could be a kidney issue, or it could be this kind of an issue. Is that kind of the study that you guys are focused on and kind of managing and controlling?
Yes. So if I could bring up one patient example to share with you one experience of how what really helped me gain such a greater insight into helping people resolve this. These parents had contacted me with their son. He was about 17 at the time, and they lived up in New Jersey. My clinic is in Southeast Florida, just above Miami, Florida, so people know that area. They came to me from New Jersey with their son. He had to drop out of school in the 9th grade. He had a bad eczema his whole entire life since he was born. They tried many different treatments, but nothing worked ever since he was a little kid. But they also told me that he had this, he dropped out of school because he couldn't remember information. But it wasn't only that his memory was so poor, but also, and he didn't do drugs. At least that's what they told me. Now, maybe they don't know every part of him, but even he told me he never did anything. He wasn't smoking or taking pills, or he didn't do anything. So he said, okay, so I took his word. But ever since he was a little boy, when he was around certain fragrances, they gave me the tip. When he was around certain fragrances, whether it was a perfume or it was a cleaning chemical, whether it was like, bleach or whatever, or ammonia, his brain would literally like almost shut off. He was like a zombie. He went from having a discussion and understanding and joking around and having a good connected discussion with a person to, once he smelled a fragrance, his brain would almost shut off. And he wasn't, passing out on the ground and dying, but his brain would shut off to the point where there was no communication with him. He would just stare off in the distance like he was having a sort of a seizure. He would just stare off in the distance and have no communication. There was no understanding. There was no talking. There was no that. He couldn't even hear what was being said to him. His brain was just like in a fog. And so I figured out with him, one of the interesting things about him was when we used in my style of testing, my method, when we found that certain fragrances like an air freshener, like a Febreze air freshener that was in an Uber. He couldn't get into Uber cars because his brain would literally like shut off. He couldn't function. He couldn't get out of the car. There was no communication. It was really bad for him. Again, dropped out of school in 9th grade because he could not do his homework. He could not understand what the teacher was saying. He just left class. So I found with my exam that he had the Epstein-Barr virus in his brain and the measles virus active in his brain. Those are two of the main, not the only, but the main causes of why the connection to why his brain would shut down, so to speak, with these different fragrances, like a Febreze or like one of those little kind of, air freshener trees that hangs from the mirror in somebody's car.
Mm-hmm.
And even apple pie was a problem. The smell of apple pie was causing him a problem. They couldn't go over people's homes during holidays because the different fragrances would literally shut this young man's brain off. So I found the Epstein-Barr and the measles in his brain. I found it in parts of his body with my work. But very interesting about him that his eczema of a lifetime went away, and so did his ADHD type of condition. He's now in Madrid, Spain, in college. The Central Office Spain to go to college. His brain is totally clear. He can smell any fragrance. He can get into an Uber. He can go into a building, in the bathroom, anywhere there's cleaning that was done. Like a bleach or an ammonia. He could smell perfumes. He could smell foods like apple pie that always showed off his brain. None of these showed off his brain anymore. We got rid of. It was interesting because I was looking for the fragrance problem, but what turned out to be the greatest insight to the body that really helped propel me even more in this direction of what I do and make me so confident in what I can help people achieve with their chronic skin rash is that the fragrances were causing him the problem in his brain that caused him to drop out of school because the viruses were there. Well, the viruses, from when I saw when we treated those, naturally that his brain problem stopped and he's back in school in another country, learning another language, right? To somebody who dropped out of school in 9th grade, but his rash went away too. The viruses in the brain caused him this learning disorder his whole life, also caused him to have the skin rash. Got rid of the viruses from the brain, learning disorder stopped, skin rash stopped.
Wow.
Pretty incredible. Yeah.
Yeah, that is
and
incredible.
We're able to actually, thank you very much. I'm able to find in any from this biophysics research that these brilliant people, actually one of the brilliant MDs behind this research, he's one of the doctors who won on the team who won a Nobel Prize for finding HIV virus, for the discovery of the HIV virus. So it's really a brilliant team, much more brilliant, I think, than me, but brilliant team that has come up with this research, come up with this answer back in the 90s. And it's a great tool to use. And all of my other schooling just kind of helped me put the pieces together and use their research and different strategies that I developed along with their research to be able to really help anybody with a chronic skin condition to restore healthy, beautiful skin again from acne or any other condition.
Yeah, no, I love that. That's a really great testimonial for sure. What a interesting situation that was solved there. This is one of the things that I kind of appreciate, Lonnie, and this is one of the big reasons why I wanted to talk to you because, obviously we're talking to Dr. Lonnie Herman. He's definitely been practicing for years. You've got a ton of knowledge. You now are giving us a little insight to your world and the stuff that you're studying and watching. And you created all this knowledge for yourself by learning all this stuff from other doctors and reading reports and doing all the heavy lifting. And then you decided to put this all into a book. The Ultimate Guide to Healing Chronic Skin Rashes, right? And so I want to know, first off, from your perspective, and just, be a little heartfelt here, I guess. Why did you decide to write this book besides just putting this information out into the world? Was there another reason behind, I want to be an author, I want to write this book, people need to know this? What was the reasoning behind that? And then we'll dive into what the book's actually about. Okay,
thank you for asking that. I'll tell you, for years as growing up, when I had this horrible hives condition, and it would happen to me so bad that I could barely breathe. My throat would close up and I had to get shots. And I remember I used to run away from the doctor with a needle. I couldn't stand getting the shots. I used to cry, but there was nothing else at that time that we could do because I couldn't breathe. I could have died with these hives. And years later, one of my dogs, again, he had a horrible rash, and it took 3 years of figuring out until I figured it out. It took 3 years of figuring it out and going to the vets and the medicines. And as I developed this system that we're talking about now and helping people were coming into my clinic and literally, I mean, they were embarrassed. They had sleepless nights. They would scratch their body so bad, or it's so bad that they had blood on their sheets. They couldn't go to the beach. They wouldn't go on dates. They didn't want to be seen without their clothes on. They couldn't have relationships. It got so bad for some people that other people in the community would stare at them and point and like walk away, try to like get around them, like don't get on the elevator with me kind of thing, or don't be near me to pay for food in the store where they went to buy food, because people were like looking at them like it was like they were an animal and like some terribly contagious person. So people didn't have relationships. They couldn't have intimate moments with a loved one because they were so embarrassed. Kids were so, it's like bullied in school because they had acne all over their face and rashes all over their body and so on. So I saw people coming to me crying. They were coming to me depressed. They were sad. They had anxiety. They had insomnia because of these conditions. They always were, like, why me? And some people had been to, no exaggeration here. Somebody came to my clinic recently, 20 doctors over 20 years, and just an embarrassing situation and frustration that was so deep in them because all the doctors they had sought care from could not help them at all. And when they started to understand what was causing their condition after we started working together and they started to see relief from their condition, I mean, some people, their body felt so much pain that their joints would stiffen up, their skin would stiffen up, their skin would crack open and bleed without even them scratching it. The skin would just dry out and crack open and bleed. And their hands, their face, their body, and people have been, people are living in their body and their skin is their kind of their home, so to speak, and they can't escape it. You can leave a home and go on a vacation, stay in a hotel and have a good time, somewhere else in a resort somewhere. These people were trapped in their bodies and they could not for a moment get a break, and sometimes couldn't even sleep at night because it was so bad, emotionally and physically. And so I decided, once I saw the relief and I looked into the research, I shouldn't say that, statistics is the word, I'm sorry. I looked at statistics around the world, not just in the United States, but around the world. There were over 250 million people around the world with these chronic skin rashes. And that's what we just know from where they're taking stats. I mean, who knows how many people there are with eczema or psoriasis or, hives or contact dermatitis or others. I mean, people are tortured. So, and the doctors out there were not helping them. And when I saw that I could help them and totally help them solve their issue for a lifetime, I just felt that it just compelled me to get my information, knowledge, and everything into a book and show examples, which I do in my book, where people can see the before and afters that are really just like amazing examples of before and after. And so that was it. I had to share it. And I also felt that, just possibly other doctors who want to learn how I do this, because there's only one of me and there's hundreds of millions of people out there who need help. And there's only one of me. How am I going to do it all? And that day, unfortunately, we all don't live forever. So I wanted to get this information out there and help people realize that there is a way. And one day when I pass, that hopefully I'll be able to pass on this method to other physicians, because it needs to continue. Because there are people who will always, because the germs will never leave us in our environment. They're always going to be on this planet. They were here before humankind ever walked the earth, and they're going to be here for the rest of the time on the planet. So people are always going to pick up these different conditions, of these different skin rash conditions. And I just felt I was driven, it was being like led to this point in life where I just had to get it down on paper and in my book and be able to share with people, because it needs to live on even after I'm gone. That's how I felt.
Yeah, I love that. And I think it is going to be a legacy for you for sure. I mean, I'm glad I'm a part of reaching other people and sharing your story and putting your book a little bit further, which is very cool. It's very, very good knowledge, and people need to kind of, go check this out and get it. Where's the book for sale currently? It's on Amazon, correct?
Yes, it's on Amazon. We did get international bestseller, which is a great feeling,
Awesome.
a great accomplishment, a great feeling. Very proud of it. So they can find it on Amazon. They can look up my name, Dr. Lonnie Herman, or just look up the title, The Ultimate Guide to Healing Chronic Skin Rashes, and get it on Audible there, or on Kindle, I should say, Kindle, or get the hard copy that can be mailed to them.
Yeah, that's really cool. Well, I definitely want to get a copy of this book. I want to read through it. I don't have any existing skin conditions, but I have some friends that do. So I think it'd be really cool to be able to put it in my friend network and move this book around a little bit and let some people get their hands on it and read it. But yeah, I would definitely appreciate you finding the time to, in your busy schedule, to sit and chat with us a little bit. I'm so glad you wrote the book, and I'm glad I was a part of this to be able to kind of spread the word and message about it.
Thank you so much. I really appreciate your time and your help in helping me to spread the word with people. It's a fully necessary thing. There are too many people afflicted with this, too many people afflicted with these conditions, and there is an answer. There is. So
yeah,
thank you.
Thank you so much. Appreciate that.
Thank you for listening to the show. Please take a minute to head over to www.savfair.com and subscribe to our publication.